from passive smoking in the house from their parents.
Well, you also recently, like so many births and so many babies that are born with asthma. But what if the parents are not smokers? Then they are passive smokers, and this is also affecting the child's growth and his own health.
The whole world. Now we have 300 million. The whole world globally, we have bronchial asthma. Bronchial asthma now because number one is increase because environmental tobacco smoke. We call it ETS. ETS is increasing globally. All the world are smoking. 1.4 billion, 1.4 billion person they are smoking. So all the planet is smoking.
But they say that, for example, in third world countries, the amount of smoking is on the rise.
Yes.
Counter to
decreasing in Europe and America.
Yes. What is the reason for that?
We know and we don't know.
We're not talking about it. We're just giving them brochures. We're talking about it.
We know. But now the new philosophers and companies, they are focusing on the women, number one, and the children. These two particularly we don't know. If we know, for example, the adults, we know, but the new generation, for example, children, 10 years, 15 years, 20 years, we don't know, and the girls for one saying, take shisha, this will make you beautiful, and this will make you more attractive.
It's a good thing. It's a peer
because they believe. Then they become more supposed to become victims or become a customer in the future. Also, tobacco affects women more than men.
But they say also it has kind of effect on potency. It can cause impotence. Is that true?
Yes, right. The potency, it will make the sperms less. Less number, less in function, in activity, and if the mother is a smoker, after 20 years she will have a boy, a male boy. This boy in the future will have little sperm. So it's very bad for the new generation.
Yes.
Also, I want you to look at this. For this the respiratory system from inside, this is the mucosa. See this, like small hair, we call it cilia. This is the cilia. This is the cilia. It present where? In the respiratory system, inside, in the middle ear, in the fallopian tube between the uterus and the ovary. That's why a woman who is exposed to passive smoke of an asthma can become pregnant, because this cilia will be destroyed by the tobacco, so the ovum will not pass from the ovary to the uterus. She cannot have children. If she is divorced, if she get rid of this smoker, she will marry another man without smoking and she will have baby.
Sometimes this is explained, they cannot have a child and then later on she marries someone else.
Yes, this one. So look here, this is the cellular. All this cellular will be destroyed by tobacco. And all this mucus green one, this mucus will be increased by smoking. That's why we will have chronic infections, they will have asthma, and they will have a lot of trouble in the chest and the, see this? This is the cellular. See the cellular, how it is very motile and functional and active, and it moves like cleaning like swimmer. See here, it becomes paralyzed, like sticky, no function at all because it has been destroyed by tobacco. See, this also will make cancer in the child, even leukemia, cancer blood, and this it can cut the umbilical cord, so the child can die inside the uterus, or die immediately after birth, and it will decrease his weight. So see, this is the weight. See, it's very, very small because his mother is smoking more about 4 packs of cigarettes every day. Your child, very, very little weight, you can just crash being with your hand.
So how can also smoking affect the intelligence and the memory also?
Affect the intelligence and decrease
or negatively?
Negatively. It decreases the intelligence quotients.
Yes.
It causes even the child will become more hyperactive, will become more to not concentrate in the school, and will have a lot of trouble, especially in the math and especially in memory, like that. So it is against the intelligence of the new generations. Also, it will increase the chance of Alzheimer's in the future. It will affect every cell in the body, every tissue in the body, and all our sensations and all our function, because one fact, oxygen will be supplied because the hemoglobin become like a blind, and it will kiss the carbon monoxide and will forget the oxygen, so all the tissues will cry for this oxygen and they lack it, and we don't know that oxygen is present inside our body, but we cannot take it.
Well, it's also patients of MS should not be also smokers because this destroys the cells of the brain.
Yes,
is that true?
Yes, right.
So what else would that is caused by directly by smoking?
You have to know now that it will affect every cell in the body, it will affect the new generations, and it will affect the economy, because Egyptian now, the annual cost of the spending of the cigarette in the normal houses now is 110 pound per month. So the whole world are losing money for the price of tobacco, the price of the disease, and it will be about $200 billion per year. Too much. You spend on the diseases treatment, you spend on the hospital, you spend on the absence from the work, absence from the school or the college, and add for this also the victim will lose happiness and will think he is less than the others, he's not enjoying his life, and he's not enjoying his marriage life in the future, and if he has a child he will have a lot of disease like that. So completely dark epidemic.
So a lot of physicians, of course, know the hazards of smoking. Nevertheless, they smoke. And well, they say, like what we're doing. They know very well, and they are physicians, and they know what's going on. Now, how do you explain that? And how to quit smoking? A real effective way to make smokers or addicts
Number one,
think seriously about it.
Number one, make campaigns. The countries.
Do we have enough campaigns in Egypt?